Are we live?
Yeah, we are. Um, I just want to see people have started joining. Yeah, people have started joining. All right.
Is this okay? I'm sitting.
Yeah. All right. Okay. I think we have 15 so far. Yes. So we've got people joining. So hello everyone, and welcome to our today's DogSpot live session with Poorvaja Kumar. And today we are going to talk about working dogs in schools and hospitals. And I am your host for today. My name is Preeti Singh, and I'm a certified mental first aider and founder of Mind at Ease, a mental health initiative. And today with us, we have Poorvaja Kumar. She's a dear, dear friend, and she's also a certified canine trainer and behaviorist and founder of Humans of Canines. So, welcome, Poorvaja.
Thank you, Preeti. Thank you so much.
I'm so glad I'm doing this with you. So, if you can introduce yourself for our viewers, please.
Sure. So, like Preeti said, I'm the founder of Humans of Canines. It's an initiative that brings dogs and humans together. I'll be talking about it further when we have our discussion. So, I am a internationally certified canine trainer and behaviorist. My background has been primarily in health and mental health. I have degrees in psychology, social psychology, and medical and psychiatric social work from institutions like London School of Economics and Tata Institute of Social Sciences. So that's the reason I integrate both canine behavior and human behavior to create something special. Yeah,
Yeah,
that's
awesome.
my background.
Thank you. Thank you for sharing that. So, what has been your journey of being a canine trainer? How it's been so far? How did you come about becoming a canine trainer and behaviorist?
Okay. So my journey, as you can see, has a lot to do with mental health. As a child also, and even as an adult, I've always been intrigued by human mind, how it functions, community behavior, how communities behave a certain way. So because of my background in psychology and social psychology, I started exploring a lot of solutions to complex problems using indigenous methods like music, dance, theater. So I'm also a certified dance movement therapist. So I use all these methods to create well-being. And because I've grown up with dogs all my life, I've been with dogs, and I realized that dogs create a very it's a great impact that dogs create in human life, whether you have pets or you around community dogs, especially in India. So that gave me the idea of why not integrate canines into the world of therapy. And that's when I went in for courses and qualified myself as a canine trainer behaviorist under Shirin Merchant and John Rogerson, and went into the area of therapy also, and created Humans of Canines, a platform that brings all of this together.
Wow,
So
wonderful.
that's my journey.
Yes. Great. So for today's session, we have working dogs in schools and hospitals. So we all know we all know dogs. They're like great pet. They are great pets and great companion for life. Now, what is this concept of working dogs? Can you just share that with us, with our viewers?
Sure. So, in my opinion, all dogs are working dogs in a way, in the sense all the dogs have a purpose why they were bred. A Labrador is supposed to retrieve, a Beagle is supposed to sniff. But working dogs, the whole concept is about dogs having a job, as simple as that. So there are multiple kinds of working dogs. You talk about service dogs. Service dogs are dogs that assist a person in need. Say people with visual impairment have assist dogs. People with hearing impairment have assist dogs. Seizure alert dogs are again assist dogs. Then there are, say, police dogs or military dogs that work with law enforcement personnel. And then there are detection dogs that work with that are trained to identify substances, group of substances. Then there are rescue dogs that help rescuing people from avalanches and other natural disasters. You also have herding dogs like our collies that help in with cattle. And another category of working dogs is therapy dogs that ideally work with and in the area of animal assisted interventions. So
Okay.
interventions that are specifically for that are led by that those animals. So they are therapy dogs. Yeah.
Okay. So what is this animal assisted intervention? What is this?
Okay. I don't want to sound too technical, but animal assisted intervention is an umbrella term. So, animal assisted intervention, what really comes under it is three different services, that is, animal assisted activity, animal assisted therapy, and animal assisted education. So, if you look at it overall, animal assisted intervention is an intervention that is led by an animal. In my area of, if you look at my area of interest, it's dogs. So
Hmm.
an intervention that is led by a dog, it's more structured, it's goal oriented, more or less, and it could be recreational in nature. So it's an all encompassing terminology. Again, okay, I got too technical again, but yeah, so it's the terminology that you use for these three categories, that is animal assisted activity, animal assisted therapy, and animal assisted education. Yeah.
Okay. So with animal assisted activity, like what kind of activities it entails and what is the outcome that you're trying to achieve with that?
uh, Animal assisted activity, if I have to like define it or explain it, it's more like a recreational fun activity, to put it simply. It's an activity that is obviously led by an animal, but it is more informal in nature. There's not necessarily a goal that is set. Um, it's more casual, so to say. So you go to a particular setting, say a corporate organization, where I would take Murphy. So Murphy is an entertainer. He loves to please people. So he'll do a lot of tricks, a lot of fun. Kind of, it's more like a stress relieving session where everyone comes together. They pet Murphy, they play with him. So for that particular period of time, there is a temporary stress relieving sort of a session. So it's not, again, you're not targeting a particular person or a particular disorder, but you're looking at it from an overall perspective. There is some amount of planning, but it's not goal oriented like animal assisted therapy.
Okay. So
Yeah.
with animal assisted activities, so you said for the viewers, Murphy is Poorvaja's beagle dog, and he's trained to do all these activities. So with activities, so when in a school setting, so what kind of schools that you go in with an activity in mind? And is it like any general mainstream school, or is it like some focused group that you're targeting with activities?
So animal assisted activity would be pretty much can be practiced anywhere. It's again in a controlled setting. You can't just go on the streets and practice something like this, but it can be practiced in schools, in hospitals, in universities. In fact, I take my dog Leo to RWA meetings. We plan an activity before the meeting begins. It's seriously, it works. I mean, you know how heated those conversations get. So it's
Yeah.
more like before the
Peacemaker.
discussion. Yeah, exactly. So animal assisted activity can be practiced anywhere as long as it's a controlled environment. So schools can be even special schools. It's not just mainstream schools. So you can practice animal assisted activity pretty much anywhere. Yeah.
Okay. And for the viewers, Leo is golden retriever. Purvaja's golden retriever. So he's also trained to do these things. Okay. So I did see Leo's one of the posts, or maybe it was in the newspaper. You taking him to a school. So what was that? Just share that incident. It was amazing.
You mean the one where I took him to examination?
Examination hall.
Yeah. Oh, yeah. That was super fun. So that was quite, that was fun. Again, I did contact a few schools and I spoke to a few educators there. It was not, the goal of this whole exercise was to get students to kind of be stress free before they enter the examination hall. It was a very simple exercise, but because Leo loves kids, I felt like Leo is the perfect one for this activity. So we stood outside examination halls during the board exams, and we had a banner which said, "Give a high five to Leo," and Leo says all the best. So anyone who would enter, there were kids who were super excited and would give a high five before entering, and there were also kids who were slightly scared but would have a smile on their face before they entered the examination hall. And that's precisely what we wanted to achieve. Just have a smile on your face and enter the examination hall, because there's so much stress. See, these things would never happen when I was taking an exam.
I was saying that, like, I wish there was Leo and there was Poorvaja Kumar, there was humans of Canine when I was going through my 10th and 12th stressful board exams.
I
So
know.
that,
Yeah.
yeah, that's great stuff.
Yeah.
So in activities, so as I understand, it is not like a particular mental health condition that you're trying to resolve. It is just to de-stress. Activities can be more engaging at a community group level also. You don't need a particular medical condition that you're trying to resolve with activity.
Yeah,
That's so.
not a particular goal, which
Not a particular.
be
Okay.
health or education, not a
Okay.
particular goal. But let me tell you, it could lead to something therapeutic, but it's not purposive. Like, for
Mhm.
instance, we feel stress free when we dance at probably a
Yeah.
discotheque. But when it comes
Absolutely.
to dance movement therapy, it's more structured.
Yeah.
You have to target a particular disorder or a particular issue within that disorder. So it's more structured, right? So
Mhm.
just think of it as animal assisted therapy is doing like a random dance and having fun temporarily.
Okay. Okay. So that takes us to next point where we have animal assisted therapy. So can you share that? What is that? And is that again what is when you say animal assisted therapy? Is there a particular outcome that you? Is it goal oriented? And what kind of medical health or mental health conditions that you target with try to resolve with this therapy?
Sure. So, if I have to explain my animal assisted therapy, it's very structured, it's planned, it's collaborative in nature, it's goal oriented. When I say collaborative, it means that I'm working with a set of stakeholders that are leading to that goal, that are helping me take that person or that group of people to that achieve that goal. Say, for example, if I have to work on in animal assisted therapy, I will have on board a psychologist, probably a psychiatrist, a psychotherapist, an occupational therapist, a speech therapist, depending on what the issue is and what I'm targeting. And you sit together and you prepare a plan, um, and you decide what exactly are you trying to target, what is the goal that you're trying to achieve. These sessions are very very specialized. They cannot be used like loosely. Oh, I'm doing therapy with this dog. You cannot do that. You have to have specialized people sitting with you planning the session, and this is also evaluated, so it's documented. Unlike animal assisted activity, you document the changes that happen over time. You prepare the session in a way, it's very scientific. It's not something that is so generic like animal assisted activity. So it can be a one-on-one session also. So even psychologists use dogs in a one-on-one counseling session, where the dog is there to comfort the person who is going for therapy. One very famous one is Freud using his dog Chow Chow, called Joffy, late in 1930s. So he would have his dog around and he would be counseling people, and the dog would always comfort people in distress in certain situations, and it really helped, it seems. And what was funny was the sessions were 50-minute long, and Joffrey would get up exactly after 50 minutes and go. So anyone who doesn't know how to end sessions can train their dog and
Yeah.
indicate. But yeah, I mean, that's on a jokes apart. But I think animal assisted therapy is a very very specialized field. It can't be practiced without having a healthcare or a mental health professional or a physical therapist, someone who has in-depth knowledge of the issue.
Okay. So what all mental health conditions you are trying to resolve with this if you can just share some examples or
Oh,
anecdotes, any case studies.
sure. Mental health problems. So if you look at overall animal assisted therapy, and animal assisted interventions in general, you'll see that there are multifold benefits to it. It's not just one or two. So if you
Mhm.
look at physiological benefits, there are studies that show that the presence of dogs reduces the blood pressure. um, and so they've been used in multiple settings, like for instance hospitals, right?
Mhm.
Johns Hopkins has done a study where they introduced dogs to patients in ICU, and uh, the ones who actually were in touch with animals had a better recovery rate than the ones who were not. So it's physiological, right? Then two, you can talk about cognitive, problem solving skills, memory. Again,
Mhm.
many studies talk about it, like Tufts University did a study. You can also talk about something as which is very close to my heart, which is social, because I've studied social psychology. It enables communication. It is more welcoming. It's because again, dogs are non-judgmental. They are more welcoming in nature. It creates a non-threatening environment when you have an interaction with a dog. So these are overall benefits of animal assisted interventions.
Mhm. Okay.
Yeah, I
So
can
in
talk about.
yeah,
Sorry,
so
yeah.
just mental health, I wanted to check. Like, so are they, does this animal assisted therapy also works where there is a clinically diagnosed mental health condition like bipolar, depression, or anxiety, generalized anxiety disorder? Or, so do you target that as well, or are you engaged in such clinical works?
Absolutely. Like animal assisted therapy, if you talk about it, when it comes to specialized, because it's a specialized field, you also have specific conditions that you target. Say, for instance, schools. And if I talk about, say, special schools or even schools, mainstream schools, there are children with learning disabilities, say dyslexia, dysgraphia, dyscalculia, or even a basic fear of reading. So there's this program that everyone can look it up on the internet. It's called Reading with Rover. It's a program in the US where children are asked to read to the dog. I try to implement the same here in mainstream schools and some of the play schools. Um, what happens is, one, the children are allowed to make mistakes there. If they mispronounce, it's absolutely fine. The dog is not judging. If the children are repeating certain sentences, it's absolutely fine. So it's a non-threatening environment, and in this whole process what happens is the child gains a lot of confidence. There is reduced stress when you're reading to a dog, and eventually it has been noticed that children with learning disabilities are able to read aloud with a lot more confidence. So learning disabilities, wonderful. Then in schools again, another benefit that animal assisted therapy people have seen is children diagnosed of ADHD, attention deficit hyperactive disorder.
Mhm.
Their children don't understand verbal cues. It's very difficult for them to understand verbal cues. They don't have any peer connection because of their specific condition. Dogs become like catalysts, because what happens there is, one, dogs don't necessarily require verbal cues. They understand body language, so even pointing, movement, they understand really well. So
Okay.
people have reported that their children have benefited from such therapies. Um, Again, schools, autism, very, very, again, it's a spectrum. They say that if you met like one child with autism, you met only one child with autism. So you have to like know exactly what the audience is. So if a child has like some repetitive behavior, say flapping of hands, which is very common in children diagnosed of autism, what happens in that condition is dogs are trained to distract the child at that moment. So the moment that happens, the dog distracts, and it has been studied that this repetitive behavior reduces over time with the interaction with animals. So this is of course schools. So these are
So I
specific. Yeah,
Yeah.
yeah.
So I've also seen in different settings, though not specifically for schools and hospitals, but a lot of people, they get pups to say that this is a therapy pup. So what is are pups really? We will get to that. I know we will. Maybe we can park that question if you want to answer that now or later. But that's one thing that I wanted to understand, and maybe when we get to the preparation for animal-assisted
Mhm.
intervention, we can talk about the pups. Because so far
Yeah.
that you talk, like whatever you've shared is you're dealing with like serious mental health conditions. And obviously, I can't understand how will fit into this scenario. So then that moves on to our animal assisted education. That's the third segment that you mentioned within the animal assisted intervention umbrella. So again, in education, is it what education? Is it like teaching in schools of children, or again focused groups, all schools, and what kind of outcome are we looking for?
Animal assisted education has actually one of my favorites because the dog becomes the professor or the teacher. So it's super fun. At the same time, again, this also is goal oriented. The goal here might not be necessarily health related, but it's like an academic goal that you're trying to achieve by introducing a dog into the curriculum. Again, I mean, I'm talking about dogs. I'm sure other animals also are equally, I mean, they're used in similar sort of settings. But like for instance, I can give you an example. I Murphy becomes Professor Murphy with children. So yeah, they call him like Murphy Sir, and it's
With
quite
his
fun. Yeah, I mean, sometimes we dress him up and we make him wear like a like glasses and all that. So he's super fun, very good with kids again. So what happens in that is he knows a trick. I've taught him a trick of counting, counting on command or addition and subtraction, very basic level. And in these play schools and say primary schools, where there is basic mathematics, we introduce this into the curriculum. So with we work closely with educators here where we
Mhm.
introduce something like this, and so what happens is it's a lot more engaging. Every child wants to give Murphy a number, every child wants to participate, every child wants to go close to Murphy, and imagine how can mathematics be so interesting. I mean, not for
Oh
me.
yeah.
I mean, I've been like super petrified with numbers all my life, and I only wish I had Professor Murphy teaching me as a child so that I would have enjoyed the session,
Yeah.
mathematics a
I
little
wish
bit more.
I
Yeah.
really wish Murphy was the professor in my time when I was in school. I really wish so. So
And
we need more Murphy like.
yeah, so
Uh,
animal assisted education is more goal oriented. We talk about certain concepts also, like concept of say consent, which cannot be taught to a child using a textbook, right? So you have to be a little bit more. You have to make it more participatory in nature. So
mhm,
introducing a dog and teaching something called consent and touch, you won't believe like 3-year-old children coming and talking about things, verbalizing something like I don't like being touched here, as as
mhm,
deep as that, is extremely, I mean, something that I feel it's so powerful.
yeah.
So I think animal assisted education is extremely powerful medium to teach deeper concepts at a very early stage.
Mhm. Yeah,
Yeah,
and that's I think, the need of the hour with all the current challenging situations that we're going in. We have to find these innovative ways of teaching and education. So with its education, it's not just the children with learning disability. It is with anyone, and it's just one more innovative way of educating a child, right?
absolutely. Not just children. I think it can be used in adults also. Concepts like compassion, empathy. Um, how do you teach an adult about it? How do you make an adult verbalize it? How do you make an adult experience it? It's very difficult to get an adult to talk about empathy, especially because there are so many preconceived notions after a certain stage in life. So I think these alternate mediums like canines or any other animal are extremely effective, whether it's child or adult, in any setting, school or hospital. Yeah.
Okay. All right. So how does one prepare for it? Like in terms of how do you prepare a dog for an animal assisted intervention? Any of these segments. So how do you prepare a dog? And then we'll get to an organization.
Okay. Um, Preparing a dog. Okay. So if I have to go to the history of dogs used for therapy, I would say there are there are breeds like retrievers, golden retriever, as well as Labrador retrievers, border collies, Irish setter. They've been even spaniels. They were used extensively for this purpose of therapy. The reason being they enjoyed like fetching. There are certain activities that these dogs are meant to do that is innate, like that it's their innate behavior. So they would enjoy these things. So that's why they were used. Now, of course, people are using rescues, mixed breeds for similar sort of interventions. Um, I would say breed is important to an extent, yes, but more important is the temperament. What
Hmm.
you need to know is whether the dog is fit for a setting like this, whether the dog is appropriate to participate with, say, children or adults, with children with special needs, adults who are slightly differently abled. So you have to prepare the dog to be, if you want your dog to be a therapy dog, you have to prepare the dog
Hmm.
accordingly so that the dog can effectively participate in such sessions. Say one is, of course, you should. Coming to your previous question when you were talking about puppy,
Yeah.
yeah, yeah. You might want to repeat that question in this.
Yes,
Uh,
yeah. So, and actually, there is actually a question, and we're at the right point. So, AK Mittal is asking which breeds are the best suited for the purpose of animal assisted therapy. Is there any change in normal behavior of an animal when specifically used for the purpose? So, I know we are at this question, so I think it's a great question. And so, I have seen in some settings that the pups are used as therapy. So, they say that in certain settings, not really specifically, I've seen in schools or yeah, in some schools also, some people have seen they just bring in pups and say this is for therapy or this is for education. Does that really fit in? So when you're saying temperament, like a pup's temperament is yet to develop, like there's so much to
exactly.
go, like there's so much to learn for the pup right now. So how does that fit in? Is that really therapy?
Exactly. So, like you rightly said, pups are going through a development phase. It takes a very long time. Therapy dogs are very specialized dogs. It's not like it's a job that they are performing. They're supposed to be trained. So you have the dogs have to go through a basic obedience training, and it has to be proper. It can't be like, oh, my dog sits here, but when I go out, my dog doesn't do that. No. So the connection between the dog handler and the dog has to be so strong that you wouldn't require treats, you wouldn't require games, but all you need is that emotional connect with the dog that's so strong that the dog obeys your commands. And when I say obeys, enjoys obeying your commands, like really enjoys. um, like Mr. Mittal pointed out, like what kind of breeds. Again, like I mentioned, there are certain breeds that have been used over time in such kind of settings, but let me tell you, it's not like it's restricted to these breeds. It's all about the temperament, and we would come to something called temperament testing for therapy dogs, which is extremely important. Which is something that you have to go through. There is a test that each dog goes through, the dog that wants to participate in such activities in a therapy session. Then the dog goes through a series of tests to qualify as a therapy dog. So it's not as easy as, oh, my dog is so friendly, loves
Yeah.
children, so let me just take him to therapy session. That doesn't work. So it's
And
a,
here in this,
yeah.
yeah. So in this scenario, what is like what is the importance of handler here? Is that same as to a dog? Because dog is getting judged, the temperament is getting tested, and obviously he's going through a series of tests and performances before he qualifies to be a therapist. Is there a important role for a handler here, or is that
So
just
the
any?
dog is not the only one being judged. So let me come to temperament testing. Temperament testing happens as a team. A therapy dog is not a therapy dog all by himself or herself. A therapy dog is a dog that um, is a part of a team. So therapy dog is dog handler plus therapy dog. And when you test a therapy dog, when you test dogs for therapy work, you have to test the handler also. So there are two. broad areas where you kind of test. One is skills testing, where you test basic obedience of the dog along with the handler. You're
Yeah.
also constantly assessing the handler's behavior. If the handler is very rough, then the the dog loses marks. The dog team loses marks basically. If
So
the
it's a
dog,
teamwork.
yeah, yeah, it's a team assessment. And
Mhm.
if the handler is say if the dog is like mouthing and jumping over the handler and the handler is unable to handle, again, marks are I mean, you lose marks. um, uh, as simple as if the dog pees in between the testing, the team fails. Things like that. Again, the handler and the dog have to have such a strong connection, which is not developed from coercive methods of training. It happens only with expressions, emotions. The dog and the handler have to be connected. The dog should not fear the handler. You can
Mhm.
assess. That happens at the skills testing level. Then comes the aptitude, where you are doing like a noise sensitivity test. The dog should be okay with all sorts of sounds and all kinds of sounds. I mean, it has to be even loud sounds in conflict-like situation where people are fighting. How does the dog respond to these things is what you're assessing. Touch. You know that when you're going to take your dog to specific, say, special schools, or you're going to take your dog to say in certain say even hospitals for that
Yeah.
matter, there could be chances of rough handling. Children can pull the tail, pull the ear. um,
Mhm.
how do you prepare the dog for it? You socialize the dog from the very beginning. The moment the puppy comes home from 3 till about 4 months, you're going to have to rigorous work on this rigorous socialization method, where you are exposing the dog to different kinds of sounds, different kinds of touch, clumsy touching. You're going to expose the dog to different kinds of settings, where the dog gets used to, say, if you're going to work with children, you're going to expose the child to different kind of children. And when I say expose them, you're going to teach the dog to be calm around those situations. Not like, oh, my dog loves children, so he's jumping all the time. No, that doesn't work. The child can love children, but yet learn to ignore children, and at the same time allow them to be petting them, playing with them. So
Yeah.
something like that. So
There's the
rigorous socialization.
So the constant touch by children, because obviously if you take a dog to a school setting, it can get really overwhelming for the dog if the dog is not really trained to in that atmosphere. So it can really stress them out and they can get snappy and obviously react in a way that you're not expecting that. So it's not safe for
Absolutely.
children
Yeah.
and dogs as well. Okay. So we
I,
have, I see there is a question on how pets help in maintaining mental health of the owner. I know you've covered it already, but for Sandeep, Etya, I think you would just want to go over that one more time
yeah.
and then
So, yeah, mental health. If you're talking about pets and mental health, that doesn't fall under therapy dog. You can have a dog at home that serves a therapeutic purpose. So that doesn't fall under working dog, a dog working for therapy. I could have a dog, and like, as if I could give my example, I do get anxious quite often. If there's something that stresses me out, all I need to do is just pet my dog, and it kind of calms me down. Is this therapy dog? No. Is it therapeutic? Yes. So we need to know that we can not confuse the two terms. When it comes to therapy dogs, they are working dogs. They are meant to be trained for a specific purpose to achieve a certain goal. But if a dog at home is serving any therapeutic purpose, is adding value to your life, is helping you evolve, is helping you deal with any sort of mental health issue, it's wonderful, but still not a therapy dog. So,
yeah,
yeah,
yeah.
so I wanted to make that very, very clear, because my problem is people use it interchangeably. So
Yes.
it has to be very, very clear. Yeah.
True. So as a like a founder of Mind at Ease, a mental health initiative that we run, we get a lot of calls. I personally get a lot of queries where I'm going through, I'm very sad, I am feeling depressed, and the term depression is also used very loosely these days. So, and they say that we need a pup, we want to adopt a pup, we want to get a new dog, we want to get a like a rescue dog or any dog. We just want to buy a dog for that matter. I keep educating them that that's not the way. Like, you just can't go get any dog if you're looking for a specific purpose. One, it hasn't been diagnosed. Like, if you say that your children are ADHD, you have hasn't been diagnosed, or it's just loosely using that term, like ADHD or depression.
Yeah.
And there's a process that you need to follow before getting a dog. You just can't get one pup or buy one pup or adopt one pup and think that that's going to give you like help you resolve your mental health condition or make it better for you. Yeah, I think due diligence has to be followed for sure.
Absolutely. I mean, I receive calls saying, "Can I get a therapy dog? I'm feeling sad." That's not how it works, right? So that's what I think. There is lack of awareness in this field. That's why things of this sort, I mean, these queries come. Yes, when you have to get a dog home, and if you want to resolve a particular mental health issue, if you contact a canine behaviorist or, say, for that matter, a trainer also, and if you want to go through the whole process, then I would really recommend contacting your psychologist also. And I mean, a trainer and a psychologist can work together to see what exactly is the what exactly are you trying to achieve from it, whether the person is fit to be able to take care of a dog, because having a dog home is also a big responsibility. And
Yeah.
a lot of people who have already, say, a child with autism,
Mm.
a child with ADHD, the entire family goes through it. It's not a mental disorder for a particular person. It's the entire family that goes through this whole process of dealing with it. So, are you adding to stress? How is it
Yeah.
going to be therapeutic? It's something, it has to be done with mental health professionals. Please don't
Mm.
go and get a dog just because you've been diagnosed with something, or you some mental health issue, or you feel sad at that
Yeah.
moment. Please don't do that. It's a huge responsibility. Let's do it methodically.
Yeah, true. Because if you just simply get a pup, and it's if you already have a children at home, you have a responsibility, and then on top of that, you get a dog, another responsibility, and it's a lifelong responsibility because it has to be a happy space for the dog and for the family together collectively. So it's going to be part of like the forever home rather than just getting abandoned eventually. So in order to avoid that, so what Poorvaja is saying, I think we need to have a method to the process. It just can't simply go pick up impulsive decision of buying you. It's like another living being that you're getting, and there is a purpose that you want to solve with that. And so preparation on dog we've talked about. Now, what is the preparation that an organization like a school or a hospital needs to do before they decide to get a dog as part of the animal assisted intervention on campus for an activity or a goal oriented?
Okay. So, ideally, animal assisted activity or therapy are usually visitation programs because they are specialized. So, a dog is trained to do that activity for a couple of hours and get back. So, we shouldn't confuse it with, oh, my campus has therapy dogs. It doesn't work that way. If the dog is just walking around, being in an environment that probably leads to reduction of stress, that's great, wonderful. Many schools do that, and I totally encourage that also. If I could name, like Prakriti has dogs at in on their campus. There are many campuses in Delhi University who have dogs and people petting. They're not therapy dogs. So if you're talking about therapy dog, you have series of preparation that goes into it. If you want to bring a therapy dog, of course, contact a person who's practicing animal assisted therapy. um, Sit and set the goals along with the person. Have your guidelines in place. Remember, you have to maintain some sort of etiquette. It's not a dog that can be just touched and people are petting and they're playing. That doesn't work. Okay, so there's this. What I do usually during animal assisted activity session is also I create a circle around the dog and I ask children to come one by one, come and pet the dog, so that the dog is also not overwhelmed, and at the same time the children also get to experience it much better. This you have to do along with the educators, along with the, say, even in the hospitals you have to do it with the
Yeah.
healthcare workers. So you have, it's a collaborative process where you have to put things in order. in hospitals you have to check if there are policies in place. You can't take a dog to a place where there is, which is, I mean, people who are prone to infections, who have like
Okay. Yeah.
compromised immunity, yeah, immune systems. So things like that, you have to do a proper check before you start any such intervention in any such place. um, Say, even preparation for us as therapists or as dog handlers, like I have to check if I'm going to a for a session with children who are diagnosed of autism. I have to check what is their sensitivity to, say, sound, say colors. Maybe if they don't like a yellow, the yellow color, if one of them doesn't like yellow color, I wouldn't be wearing a yellow t-shirt and going, right? So I have to know the audience really well. So make sure that you prepare yourself really well before dealing with these, um, or indulging yourself in such kind of activities or yeah, therapy sessions. Yeah.
So for hospitals, is it a guidelines policy? All of that is in place, like that they need to have those things in place. So is it again hospitals only for children or adults and senior citizens also? And again, the therapy can work across age groups. The animal assisted therapy.
Yeah, animal assisted therapy has worked across age groups. If I have to, yeah, specifically mention, um, dogs have been used in with people with Alzheimer's, dementia, because it helps in, there are cognitive benefits of it, right? And also stress relief, like I mentioned. In hospitals where I go, if people are on wheelchair, are not mobile, we work on fine motor skills just to improve their mobility, just to make them feel, there's some sense of empowerment if they move even a few inches, which they're not able to do otherwise. So it works across age groups. There's no such thing as it's only meant for this population.
Yeah.
But for dogs, yes, you have to prepare a dog for a specific age group. You have to prepare a dog for a specific disorder. When it comes to
Okay.
dogs, then you have. So if you have decided that your dog is going to work with children, then you have to prepare the dog to work with children. The dog might
Mhm.
not do very well with adults, so you have
Okay.
to assess that. That's very
Mhm.
important. It's not about the age group of people. Also, like I mentioned, knowing the background of people. If what if they're allergic to dogs, what if they're allergic to a particular animal you don't want to introduce. So make sure that you've done thorough research before introducing an animal into a setting like a hospital, specifically
Yeah.
like a hospital. Yeah.
True. I mean, hospitals can be stressful for us and definitely can be stressful for a dog if not prepared. And you were earlier telling me about your experience with this. So the bereavement centers. Do you want to share that with the viewers?
Sure. So I was working as a bereavement counselor, and I was placed in as a medical and psychiatric social worker, and I was working closely with children in palliative care. Again, extremely stressful environment, and imagine teaching and making children understand the concept of death, because that's what you know is going to happen. Um, it was very difficult to do this, again getting children to verbalize it. And there were also several restrictions, administrative or say infrastructural, to bring a dog into the session. We were doing a few music therapy sessions or dance movement therapy sessions. But what helped in this case is I showed them a lot of videos of dogs. I made them verbalize their emotions, with, say, a stuffed toy. You don't want to compromise, again very low immune system is compromised, right, in this case. So what happens is there is an outward focus, and when there's an outward focus, the children started verbalizing their emotions a lot better. Yes, there is scope for getting dogs inside hospitals, but then right now, with the kind of challenges that we face, we could do things like this also.
Okay.
Yeah.
So
Yeah.
that actually takes us to next segment, which is what is the scope for growth in India and what are the challenges that we face when it comes to animal assisted intervention? And actually, there is a question by Malvika, like, why don't we see this often in India? So, I mean, I think the timing is so perfect for this. So, because we are right on topic. Yes.
Yeah.
So, do you think India is ready? I know there are certain schools, some schools have reached out to me as well, like they want to have a dog on campus. So, that's a different thing, I understand now. So, do you think we are ready? Do we see a trend around schools and hospital being okay with the dog or using animal assisted intervention?
Yes, things are improving, I must say. Um, but what about the pace at which it's improving? That's something that I would question. Yes. The reason here, like what Malvika said, why don't we see it? It's just lack of awareness. I think mental health has been neglected as a subject for very, very long time. And it's only now because of social media, whether it's good or bad, people, whether they are using the right terminology or not, but at least I say at least they're talking about it. At least there is some platform where people have started voicing their opinions on it, talking about their own personal journeys. So I think things are improving. There is scope. Yes, there is a lot that can happen, must happen. But like I mentioned, mental health and any other alternate form of therapy, say dance, music, drama, or canine led, or any animal assisted intervention, go hand in hand. The day India or Indians start taking mental health more seriously, understand the depth of it, talk about it, are aware of it, we will see that there is an improvement in the health seeking behavior. People will start asking for help,
Yeah.
diag- I mean, will start addressing, acknowledging something like that is so deep. And once they start doing it, it will become more and more common, like any other illness that we keep talking about. So I think schools or hospitals will become much more receptive, and I think it's
Hmm.
our responsibility now to start talking about it. And it's great to have platforms like this, like DogSpot,
Absolutely.
where we are talking about it. I'm probably the third speaker talking about therapy. So that itself shows that there are people trying to understand. Even if I'm addressing 50 people and one person today goes and Googles what animal assisted therapy is, we have
Exactly.
gone somewhere. We have achieved something. So
Yeah.
yeah, I mean, you would know as a mental health professional, you would know how what are the challenges we face in this area, and
True. So
yeah,
we get, and in current challenging times, yes, and it's there is a lot of undercurrent on mental health, and I'm glad I see that people and definitely forums like these are a great platform to express all of this, and it's important that people start in its high time that people start expressing their emotions, not hide them, not label them, and I think. And then they will open up. The first step is to open up about your emotions and start expressing yourself. And then the
absolutely.
next is to go for these innovative methods like animal assisted intervention, education, and just be open about all of this. I think all you need is like an open mind to
Yes,
embrace this
yes.
new change.
Yes,
And so
and
that,
awareness of it. So, yeah, I don't know. I mean, of late, I've been contacted by several universities, even the ones that are teaching psychology. Like recently, I did one workshop for students of psychology from Lady Evan College. Um,
Mhm.
I mean, it's amazing to see that people have started taking interest in the subject. So even if psychologists start reading up on canine behavior, there will be some person trying and implementing something like this. So
Yeah.
there is hope, there is improvement happening, but it will happen only if we start spreading the message more often than waiting for the time for something big to happen.
Yeah, true, and it's high time that we get open our minds to that. So, and in current again in challenging times, we have seen a shift to virtual. Now everything is moving online. So,
Hmm.
is it possible online? Is through virtual medium? Is it possible?
Okay, so if you had asked me this question exactly 4 months back, I would have said no. It's not possible. You have to have a dog around, and strangely, because that's our new normal, so everything also changes along with it. You find there is a
We
problem, you find a solution, right? That's how we work.
Yeah.
So I've started taking virtual sessions. one reading sessions with schools. We do a lot of animal assisted activity with schools, especially because children are going through a lot of issues at the moment, because they're not able to adjust. The routine completely changes. With I mean, one of the things that I want to share is, um, I work in a mental health institute as an animal assisted therapist, and I work closely with psychiatrists and psychologists with children who are diagnosed of schizophrenia and bipolar disorder. I've been going there for 6 months, and you know how difficult, you as a mental health professional would know how difficult it would be for them to change their routine to something which is virtual.
Yeah.
So we decided to take it virtual from in-person intervention to virtual intervention. During the in-person intervention, there's this one person, one adult, um, who was who was quite passive when it came to participation, not an active participant during our sessions, would be present during the session, would never pet the dog, would never come close to the dog. And as a therapist, I'm not supposed to push the person also to do it. So we've always maintained that distance. When this transition happened from in person to virtual, just about a few weeks back, something amazing happened. So we were having the session, and suddenly I see him sketching something, and I didn't really ask because I don't talk to him that way. I'm not supposed to. With the psychologist, I have to interact. So suddenly he himself volunteered to show what he sketched. And he had made Murphy. He sketched Murphy and a beautiful portrait,
Wow.
amazing portrait like any other professional would make. And
Wow.
yeah, it was amazing, beautiful. And he said, I really miss Murphy. And that's the only time he's verbalized in the session. So it gave me like goosebumps. It still is. So
Ah.
when it happened, what then I contacted the psychologists who were also a part of the session, and they said, "Thank you, thanks to Murphy, that Murphy acted as a catalyst to help him verbalize his emotions. So now he's going to go through art therapy because they've discovered it. So you can only imagine how effective it has been, and it happened virtually. So I think there is scope. There is immense scope in this area, and
Wow.
yeah, this is an
That
example.
gives me goosebumps too. But yeah, that's amazing because somebody who's never spoken in the class was going through such a serious mental condition, and again, whole new setup of virtual settings now, getting through to the therapy through online medium, and coming out with this kind of an outcome. It's amazing. It's like so beautiful. So we have one more question. I think this is the right time for this. Namrata Rao is asking, how do you measure success or impact of animal assisted therapy since it's done with so many other interventions? So
Right.
you've answered a bit, but if you want to elaborate on that.
Sure. So, animal assisted intervention or therapy for that matter is not a therapy that is practiced in isolation. You do it along with several other therapies that you personally do, but say you work with an occupational therapist who's already working on something, a speech therapist who's probably working on the speech of a particular person. So there are multiple stakeholders, like I mentioned, involved in it. So when you
Yeah.
start a therapy session, there's a baseline, and then when you end it, there's an end line. So it's a documented session, which is very systematic. So you have to see where the person is, what is it that you're targeting. You're going to have your monitoring sheet in place, and there's an evaluator sitting during the session, evaluating constantly the effects or the changes that are happening in that person. So there is a range. It can go from, say, communication skills, if you're assessing that. Within communication, what exactly are you noticing? Constantly, a person is observing. So remember, when you're doing a session, when you are being a handler, you cannot be observing all this. So always there will be an evaluator with who knows the person going through therapy, who understands the therapy. Who is aware of where that person stands in terms of his mental health status, is constantly evaluating. So this there is a monitoring and evaluation that is done from day one till the time you achieve the goal, or even if you don't achieve the goal. I mean, it's not like 100% success all the time, but
Yeah.
it is also done in along with other therapy that the person goes through. Say it could be
Yeah.
behavioral therapy or something like. So you have to work along with these people also. So you can't be working in isolation. You have to work along with them in achieving that
Yeah.
specific goal. Yeah, I hope I've
True.
answered. Yeah.
Yes, yeah. Thank you for putting that out there. So where and we understand that from India perspective, we are moving in the right direction, but where should like we are headed to the right direction, but where should we start as to all the viewers who are here? Where should we begin? What should be our
Hmm.
starting?
The starting point is now. Why not talk about mental health? Speak about mental health. Talk about something that's a part of our, I mean, journey. Everyone goes through ups and downs. We have to be more vocal about it. I know socially, we some people might not be very comfortable doing it. You might want to seek help. You might want to seek assistance in this, and so I think the point is right now, like start right now, start talking about it, bring in awareness, start posting things about it. Don't worry about things like, okay, how are you going to be viewed, am I going to be labeled, things like that. So that's how you will get rid of stigma. There is a community supporting everyone. There is a community. I know there are people who are not supporting this idea, but there are number of people supporting this idea, and things are changing. So
Mm.
make sure that you do that, and remember these sessions are also very confidential. It doesn't, so when a setting animal assisted therapy also happens, it doesn't happen in open. So it's a
Mhm.
confidential setting. So make sure, so everyone's secure, um, everyone's emotions are intact. So I think it's time for people to approach professionals. It's time for people to post about mental health. It's time for people to create that awareness. Yeah, right now.
Yes, that's true, and so a lot of people like the few of the calls that I get at Mind at Ease is that we are hesitant to go when the moment you say therapy, they are very hesitant because there is this whole stigma attached to it. So definitely that same kind of outlet would be there for animal assisted therapy as well. And I always tell them that counseling, obviously therapy is the next step, but counseling, start with talking to a psychologist, start talking to a counselor. It is okay to open up. It is fine. Everything is confidential. But it is important that you start expressing or just sharing what you want to share and what you're feeling. And then follow the course of action, what is required for you to overcome whatever challenge or mental health condition that you're doing, because it's important. And do not be afraid of the counseling or therapist, and in animal assisted therapy also, do not be afraid that something needs to be wrong really to fix it. No, nothing is wrong. I mean, whatever you are, I think we all need therapy for sure, and to sail through the tough times that we are in, I guess, for sure. So education, to your point, Purvita, so education is important. We should start talking about it now. We should not be afraid of what we the interventions, the animal assisted therapy, education activities. We should be very open about these things, and that's definitely the step in the right direction. I will just quickly check if there are any questions that we have. We have though covered quite a lot of them already. Um, we have last few minutes, so if anyone has any specific questions to ask, please feel free to ask now, or you can always reach out to me or Poorvaja for animal assisted intervention at Humans of Canines. That is for Instagram and Facebook handle ID. So please do feel free to reach out. So I'm just trying to check um, if there are any questions.
Yeah, sure.
Which breeds are best suited? You've already answered that. Okay. Ashokji is asking, a lot of RW object to the movement of pet. So this is not the forum for that one to answer that one, but maybe offline we can share some advice to deal with that. Okay, there are some vet related questions as well, but I think we have covered. Do animals assist other animals? That's a great question that has come. Do animals assist other animals?
So I've come across some articles in the past where uh, animals go and comfort the other animals, and however, it's very I I myself haven't practiced, and so I wouldn't be the right person to do this. But I have my own doubts about it. The reason is, remember that why did we start using dogs for therapy? The reason is humans and dogs share that sort of bond, and it's like thousands of years old. So we have been providing, we've been coexisting, and we've evolved together. Like we started with hunters, gatherers, to now sitting and watching Netflix together. So that's how we've evolved. Dogs are meant to be with humans, and there's a coexistence, which means they depend on us for food, they depend on us for affection, and somewhere so do we, right? So there is an exchange. The same, I'm I doubt if there are dogs acting as therapy dogs for other dogs. But yes, there is an exchange of communication which constantly happens between
Yeah,
animals. They're
absolutely.
reading body language, but you can't call a therapy dog providing therapy to another dog. It's our human world, so let's not humanize
Exactly.
something that's a
Mhm.
different species. Yeah,
Yeah. But dogs do communicate, like they have their own ways of taking care of their own immediate surrounding or the family or whatever the extended family. So there's another question we've come actually, a couple of people have asked. Is knowledge of psychology a must for doing therapy work with dogs? And another question on the same lines is, should you be a trainer to do therapy work? And what's the qualification required? So I think you've covered it like initially, very
yeah,
first question. It's important, like what is a degree in psychology required to be a therapy dog person,
right.
like assistant
It's a
or
very
trainer?
good question, and I'm so glad someone's asked this question because I keep having this discussion with people, trainers as well as psychologists. In my opinion, um, if you have to train a dog for a particular purpose, say you have to train a dog to be working with children with autism or children with ADHD, you want to train a dog to be working with people with cerebral palsy, you have to have complete knowledge of that area to start training your dog. It's not necessary that you have a degree in psychology, but it is certainly important to know your audience really well. The reason
Yeah.
is, as a handler, if you're going to be a handler, you have to uh, you have to take decisions on the spot also. Say for instance, if you're going to be with the dog and the child with diagnosed of ADHD comes close to the dog, so you should be able to kind of intuitively, I mean, know exactly what exactly is going to happen, what is the possibility, and at the same time protect the dog and enable that therapy. So it's a very complex situation at that time. So if I
Mhm.
have only knowledge of, say, canine training, then I will not be able to look at it in a holistic way. Similarly, a psychologist, probably sitting with a therapy dog in a one-on-one session, should be able to read stress signals in dogs. If the dog is constantly yawning, giving indications of stress, like lip licking or something like that, the psychologist should be able to take the dog away from that session because you're adding to the stress. So there has to be an integration, it cannot happen in isolation. So anyone who's practicing canine training and wants to get into therapy work would require some in-depth knowledge about the population that they're trying to target. um, yeah, and vice versa, a psychologist would need to understand basics of canine training and behavior in this to
Yeah.
practice something like this.
To do the real good, I think it's important that you get that education and knowledge, because it's mental health condition that you're dealing with. There is set focused audience that you're dealing with, and with the canine around. So I think it's important that you get that knowledge and experience in hand in hand. So do one last question I think we're going to take, and then we may wrap it up. So do dogs retire from animal assisted intervention and activity? Do they, because they start after 1 year, for all these that you've shared, do they retire? Is there a retirement age for them?
1 year minimum. I mean, dogs can start 1 year at least. You should give
Okay.
the dogs to start begin to work as therapy dogs.
Okay.
Um,
Okay.
Dogs retire, so there's a lot of discussion happening around it about therapy dogs and their retirement age, because a lot of older dogs are also used as therapy dogs and they're taken to different settings. In my personal opinion, you should be stopping the moment you start noticing certain health indicators, because you have to constantly monitor the dog's health throughout I mean, his life. That's what you do, right? So after the dog reaches a certain stage, say develop something like hip dysplasia, develop something like some joint issue, you know that the dog would react differently with a particular population, would require some space at that time. So you don't want to stress that dog out. Like I said, the dogs that are used for this purpose have to enjoy the process, and you have to know when the dogs have stopped enjoying, whether it's physiological or psychological. The dog starts giving stress, indications of stress. You know that the dog has stopped enjoying a particular session. You have to know that you have to actually move the dog away. So retirement, I wouldn't say that there's a particular age. Also, another thing that happens in retirement is when you take a dog to a particular person going through this therapy, or a set of group of people going through this therapy, and the dog is really old, they develop an attachment, right? And what if the dog passes away in that process? So imagine that void, and going through therapy, you wouldn't want to risk it also. So a very old dog, I wouldn't advise
Yeah.
taking a very old dog to such sessions. But yes, certainly, say from 1 year to 7 8 years, till the dog is kind of healthy, and the health indicators are in place, the grooming can be done, the dog doesn't smell funny, all that, if it's in place, you can certainly engage with the dog.
Okay. Wow. So there is one question. It says that can we not take help from a professional if one doesn't have psychology background? I think you covered that earlier.
Yeah.
That anyways, it's a collaborative effort. So you don't have a
Yes.
psychology degree. Yeah. You want to?
Yes, you can. You will have to collaborate with a health professional, irrespective of whether you have knowledge or not. So even today, with my degrees in medical and psychiatric social work, social psychology, even today, I am consulting psychiatrists or psychologists in order to implement a certain um, therapy session. The reason is, every so mental health is a spectrum, and every person has no two people are similar going through a similar issue. They will respond to things differently. So you will have to know that population, that person, really well, what that person is, where that person stands in terms of the mental health, and that only a professional who's dealing with that person constantly would know, right? So like I mentioned, even autism, if you've met one child with autism, you've only met one child, that one child with autism. So keeping all this in mind, I feel that a background in psychology is an add-on, yes, but knowledge of that disorder is extremely important. But working with the professional is extremely important. You please don't misuse this. Don't do animal assisted activity, just taking a dog to a school or a university or any other setting and calling it therapy. That's not how it works. You have to work with professionals in a goal oriented manner, in a proper planned and documented fashion, to call it therapy, right?
Oh, wow. I think we've covered almost all the questions in some form or the other during but this has been so enriching experience, and I love doing this with you, this session with you. And thank you to definitely a big shout out to DogSpot for this platform, this opportunity, and so grateful. I really hope our viewers open up to the idea of animal assisted interventions and they do reach out to you. So if anyone has any questions post this session, please do reach out to Poorvaja at Humans of Canines. That's the ID for Instagram and Facebook, and she will try to address that for sure. Anything
Thank you.
more?
Thank you, Preeti. Thank you, DogSpot. I
Thank
love all your sessions, but I'm so glad that there are people talking about animal assisted therapy now. So I'm really happy, and I think platforms like this will take this forward.
yeah, this
So
is
thank you very much. Thank you,
important thing.
Preeti,
Thank you.
for this session.
Yeah, thank you.
Yeah.
Thank you, everyone. Thank you, everyone at DogSpot. Thank you, Poorvaja. And for all the viewers, thank you so much for joining, taking out this time for this enriching session. And I hope you also enjoyed it, but I thoroughly enjoyed it. Thank you.
Thank you. Bye.
Thanks. Bye.